It didn't even get on the table.
Okay, I'll call the special city council meeting of April 22nd, 2020 to order.
Move. Whoop.
Mayor Copeland,
Here.
Tom Baylor,
Here.
Kathy Sherman,
Here.
Jeff Guard,
Here.
Melina Meyer,
Here.
Ann Schaefer,
Here.
David Allison,
Here.
David Gleason.
I'm here.
That's all of council.
Move to approve the agenda.
Second.
Have a motion. A second to approve the agenda. Are there any additions or corrections desired?
Yes, this is Helena.
Councilman Meyer.
I would like to add a COVID-19 discussion item, probably 12A, so that if anything comes up that we want to discuss, then we can do that, not 12.
I second that.
Okay, I want to move that down under new business, and I'll call it 13A.
Well, it's 12, eh? Oh.
Well, that's correspondence. Or 12A under new business,
Yeah.
just so it's under new business.
Yes, understood.
Okay, there we go. I see 12A and I leap to following 12. Okay. Anything else? Any other modifications? Okay, so
Just do. No objection.
is there no objection to the agenda as amended to include that discussion item? Hearing none, the agenda is approved as amended. Does council have any conflicts of interest or ex parte communications to declare?
On the main motion yet?
He asked if there was.
If there was any
as
objection,
amended?
yeah,
Okay, I'm sorry.
sorry. Any conflicts of interest or ex parte communications to declare? Okay, hearing none. We have a guest speaker, the incident management team report.
Yeah, good afternoon. Since our last meeting, when I handed out the objectives from the incident management team to the policy group, we had 34 objectives and we've whittled them down to 16. A lot of them were just kind of clerical things, but a lot of it we're still working on. Chief Hicks had made a new org chart and also a new present objectives format along with our daily comments that will be put up on the website as soon as we can get the dots crossed and the T's dotted and blah, blah, blah. So moving forward, we also would like to recommend to the policy group a face covering ordinance. And also from what the governor was saying about opening up restaurants, we would like to ask the policy group to kind of carry status quo through the community with our public groups. So we can continue to do, we haven't even hit the fishing season yet and the governor's opening up the state, but we would like to recommend not opening up the community with his regulations and rules coming down. So if you have any questions.
Okay, so just a clarification on the face covering is a rule, and because Helen put that rule in place, so you're just asking for council concurrence to support that rule?
Yes.
Okay, yeah. So I hear ordinance and I start to think about codification and everything. So, and then the state has mandates coming out this Friday that are going to start repealing some of their earlier mandates, and you're recommending that the policy makers consider keeping the current mandates that we have and rules that we have in place in Cordova in place.
Yes.
Okay. Councilman Baylor.
So then I don't know where we would discuss this. I assume it's going to get on the agenda. So just throwing it out there is, there's been a lot of studies where outside seating in restaurants can be done safely. We have that capability. So for me, I would like to have that discussion before we tell the restaurants that they can't. So where that discussion starts and stops, I don't know, but just throwing it out there.
I think that would be an action item for the council to put on an agenda to discuss.
Okay, so so when those rules start getting relaxed, that kind of a phased relaxation like that.
Yeah, or I mean, I think we should probably just take it up and start talking about it, because it was, again, I'm not, we'd have to run this by the medical team, but what I have seen and read, that outside seating is a lot safer, so there is that possibility to keep some of these restaurants in business.
Okay, Council, I have Councilman Baylor's right here in the room, so I'll go right through the list here then for you online for questions or comments to the incident commander. Councilman Gleason.
And really, I guess I would say that I am in favor of the face covering rule. If we're supposed to be giving him concurrence on that, then I am definitely concurring with that. And I also would concur to not open up the community, but it looks like we're going to actually have that discussion. So.
Okay, thank you, Councilman Gleason. Vice Mayor Meyer.
Yeah, I'm, what Gleason said, I'm in, support of the face coverings, and also I think we definitely need a discussion on opening things up. And I don't know, I believe that the governor said Friday, so we may want to have that as part of the discussion for COVID policy, just to have an initial discussion on where council is at on that. And then have it on as an action item when that's appropriate to do so. But I think we should discuss it a little bit today.
Okay, thank you. Councilman Garden.
I got a couple different things to say here. I am personally in favor of the face covering ordinance we just got. As far as the questions of does every policy have to originate with the council, there are other mechanisms in our emergency management structure that things can emanate from there, policy can emanate from there, and then council has the right to either concur with that or remove it from the books at a later date. But everything doesn't have to emanate out of the council. Sometimes things have to move quicker. You know, there's perceived a need for it from out of the management structure, and there's nothing wrong with that. Two, as far as relaxing our local restrictions that we may see the state restrictions at the state level being relaxed, I think it would probably be a good idea to just hold where we're at now, but this is a big enough issue. We should probably put it on a next agenda and put plenty of advertisement out there so the public has a chance to comment on it before we make a final decision. But if we could some way come out today and just say we are holding the line on where we're at for now until we can have an advertised meeting so we can get the input from the community that we want. That's all I got on either of those. Thank you.
Okay, thank you. Councilman Allison.
Yeah, I guess I'll start with the face coverings. Just a thought. I personally, I can wear a face mask. I won't wear the cloth one, but I have medical ones that my dialysis center provides to me, so I'd be happy to wear that. But I think it's better to have it be requested but not required, I guess. And my reasoning is that the people who are going to wear the mask on a voluntary basis are the people who are going to have a stack of 3 or 4 in their house, and they're going to throw it in the washer as soon as they get home and wear a new one the next time they go. They're going to be careful with how they handle it. People that don't want to wear them, but you're requiring them to wear them, they're going to wear the same one every time, all the time. They're going to have it sitting in the pickup truck next to their seat, and they're just going to throw it on. And that thing, within 3 days is going to be more contaminated than the toilets at the harbor. So I just got my caution about requiring people to wear face masks, because I think that those that don't want to wear them are going to end up contaminating more than they could or than they should. That said, I definitely think we need to have a discussion on the opening up places. I don't have a problem with it, with the governor's stipulations, 25% capacity in the restaurants, et cetera. But we need to make a decision before Friday morning, because Friday morning is when it comes into effect, the governor's thing. So unless we do something different, then I think state rules will apply there, unless we have something more something to extend that locally. So I think if the big cities can do it, so can we. So anyway, that's my thought.
Okay, Councilman Schaefer?
Hi, yeah, thank you. I am in support of the face coverings mandate. I was also a little confused about the process, but I think I understand it better now that because of the emergency order, they can pass these through the team, and then we can choose to support or not. But yeah, so at this time I am in support of the face coverings. I think we need to do, along with the mandate though, I think there needs to be a ton of public education of, how to keep those clean, so that we're staying safe. So there needs to be a big public education push and making masks available for people. So there's that. And then the issue about the governor starting to open up the state a little more, I feel like we're going to have this influx of people into our small community, and I think it's probably best to just err on the side of caution at this point. We haven't had a case yet that we know of, but we are about to have a bunch of people come to town. The restaurants can just still do the takeout that they've been doing. And so I'm of the opinion to continue as we are currently.
Thank you. Councilman Sherman?
Thank you, Mr. Mayor. I am wholeheartedly in favor of the face covering rule. I understand the process that we went through for that. And I have been wearing face covering anyway. I agree with Ann that some education needs to get out there, and I think that's an easy thing for us to do through the IMT-PIO team. And as for, I guess some clarification, is the governor's rule coming out on Friday, or is he announcing what's going to be happening on Friday itself, or does the rule go in place?
The rule is going to be in place officially as of Friday, the 24th.
He's already announced, Councilman Sherman, he's already announced what he's doing, and then it's going to be effective Friday.
But the language isn't out. It's supposed to come out.
Oh, the language isn't out yet.
Language says today, but
Okay.
it's not there yet.
So in that case, some of these other things that the governor has said is, as a small rural community, we have opportunities to decide on our own. Is that still the case?
Yes.
So, and to be clear on process, the incident management team is going to keep those in place. They're signaling you, council, that they're going to keep those in place. They're asking for concurrence because when they actually implement it, council will have 5 days basically to overturn it. So that's kind of how process works, right, Helen?
Yeah, I just want to say that what our official position is that we're communicating that unlike other communities that don't have a huge influx of people at a very specific time like Cordova has, the governor's mandates make sense. It's status quo. Anchorage doesn't see a huge change in population. They've got their infection rates under control, and they're ready to just kind of stabilize things. We are in a different position where all of a sudden, huge influx of people, the whole landscape changes. So our mandates are going to stay in place until we have an opportunity to identify how that influx of people is going to impact our community and our ability to respond to a potential COVID outbreak. So totally have that locked and loaded. We will have new language in our mandates coming out, our rules coming out. We're just waiting for the final language from the governor so that we understand how to react. So again, we will have the right language in place to keep things as they are now. And then if council wants to make any changes, obviously, we're used to changes every minute of every day, so we'll do it. But I think we're in place to keep things as is until you, as a council, say we want to go in another direction in consultation with the incident command team.
And also, I'd just like to say that what we are doing right now is working. So let's not change it until we know when to start easing back a little bit. And I think it's too soon right now.
And I just add for, oh, I'm sorry, is that Councilman Sherman?
Yeah, I was just going to say, then I completely concur with the incident management team, and I also agree that it should remain status quo. Thank you.
Okay. I would just add the PIOs this morning went on CDC and got some basic masking guidelines, and we incorporated that into the noon radio spot, the small spot. So that went out, goes out at I think 1, 5, and 8 o'clock to start giving some masking guidelines, communicating those to the community. So I'll start back at the top. Again, thank you for the concurrence and guidance there. Councilman Baylor?
Yeah, so in regards to the mask, I'm kind of on the fence on that. I kind of understand what Councilman Allison is saying. But part of my problem, I disagree with the process that was used to develop this plan. I think if you go back to your what is it, emergency operation plan, to me, it clearly spells out that this is a policy and medical decision that should have been discussed. And what I like about that is we would do that in an open session, and that would allow the public to give us input and suggestions. So that I don't care for. I think if we're going to have this plan, we probably should follow it. And quite frankly, I think the wording on this is poorly written. The way I read it, I guess if I go out on the docks and as long as there's nobody else there, I don't have to wear a mask. This is what this is telling me. And to me, that makes no sense. Either you're going to wear a mask on the docks or you're not going to wear a mask on the docks. It's unclear to me if I want to walk out White Shed Road, can I walk out White Shed Road without a mask? Or is there people, if there's people there, but I can keep 20 feet away? You know, all of those little nuances. I just don't, I think for me, the intent would have been the downtown business area, grocery stores, the post office. I think you definitely should be wearing a mask in there, but some of these other areas, I don't think it should need to be required. And again, the process, and that's why I would have loved to have the public input in this. Also in the, as far as the restaurants go, if you look under your position checklist for the pandemic period under command, control, and management, it spells down there, determine when to close and reopen schools, businesses, and other public events if necessary. And under that, the heading, who's responsible for that? It's the policy group. So that kind of speaks to your restaurant. So you definitely would want to get input from your medical team. But again, that brings that into the public forum so everybody can comment on it. And I think when you get the public to comment on things, you get better buy-in and things will go smoothly. So those are my comments. And maybe at some point they can address this, whether we're going to follow this emergency plan or not. So if we're not, then I'm not sure why we're meeting. Thank you.
The medical staff was consulted on the masking, though, and had input to that. So, Council, other comments or questions for Incident Commander?
Yeah, this is Melina.
Councilman Meyer.
I somewhat agree with what Tom is saying about how it's written. I know that I had to read it a couple times to really understand where and where not you have to, where it's mandated. I don't know who wrote it. Maybe it was the attorney. But I think it could have been worded in a way that was a little clearer. I think some of the messaging of educating the public, I think that those messages were a little clearer than how it's written in the mandate. But that was my initial thought on the covering. While I'm very supportive of the mask covering, I think how it was written was a little confusing.
Helen, did you want to comment on who wrote the plan?
Holly's online, and I think she can speak to some of anyone's questions. Holly?
Sure. So the rule was written, Helen and I wrote that together. A lot of the language was my language, and it's very specific language. It's tailored to ensure that your rule does exactly what the CDC allows and recommends and stays very close to that language, and that the rule does not go beyond what is necessary in order to accomplish the goal. So you get language regarding individuals who are with their household members or alone. That language stems from the need to ensure that you are not overly restricting the individual liberties in order to respond to COVID if it's not going to be scientifically based. So the CDC, for example, requires cloth coverings. That's what they recommend. And they recommend cloth coverings for individuals over age 2. So we can expand that to age 4, but we wouldn't want to go under age 2. And the CDC recommends that individuals with trouble breathing and medical conditions are exempt from the rule. And so that language is taken directly from their directives.
Holly, can you also speak to, there's some question about the emergency management plan and the different, how it all works, that there might be some question as to whether or not we are following it appropriately.
No, I think that you are following it appropriately. The emergency operations plan, one of the problems with the emergency operations plan, both the state plan and the local plans, are that they never were designed to respond to continuing and sustained emergency that we have with the pandemic, as opposed to, say, a natural disaster. So when you see references, for example, to the policy group, policy is a term that can mean a lot of different things, right? And if you are devising a plan to respond to, say, an earthquake, your policy group is going to make determinations regarding strategies for rebuilding the community, or do you want to make it look different if half of your streets have been leveled? Do you want to, there's these large, overarching planning concepts that may come into place that will then be taken by your emergency management team that's operating on the ground in real time and incident response, and that would come into play. And you would go through those policies and you would adopt them under your normal course of action. Here, whether you adopt a rule restricting a facial covering that will have immediate impact on the spread of the virus in the city, and therefore an immediate impact on the emergency, that is not necessarily policy. Council still has its long ability. You can still say, the emergency operations team has implemented social distancing restrictions and taken these other steps, but we as council want to communicate with the public and go further. We want to do something else, right? Then you can use your normal course of business to take those steps. And we can create and devise a means for you to do that, and we anticipated that in your fines, right? So now your fines allow for cancel mandates. We could create a city council emergency rule that you would adopt for your normal course that would supplement and be incorporated into the mandates adopted by the city manager as the director of the emergency operations team. But when you have these, are restaurants open or are they closed? Do we require 6 feet separation? Do we have quarantine? Can we enforce quarantine? That's all immediate response to the emergency. And that, in my mind, does not fall under policy. That falls under response. So this policy, putting you in a policy bubble on a piece of paper doesn't really tell you anything in reality. It doesn't give you direction as to how the emergency operations team functions. Emergency operations are triggered by an actual emergency, and it's designed to put a single government official at the helm, and in this case, you use a unified command, so you have 2, right? You have Mr. Tremblay doing operations, and that's, how many masks do we have? What quarantine locations do we have? How many PPE teams or resources do we have? That's Paul. And what rules do we have in place to protect our community right now on the ground? That's Helen. And the team as a whole informs everyone. Informs Helen and Paul as they make these leadership decisions. Council stays as an oversight. The rules come before them, not necessarily before they're adopted, but they are there. They're watching, they're being informed. The public has an opportunity to weigh in, but not always before they're adopted, because the adoption is triggered by a state of emergency, so it moves fast. So I know these concepts are hard to understand, and they're very hard to explain telephonically, but I'm hoping that helps. Does that help?
Is there any council comments online before I go back to Councilman Baylor?
Well, yes, this is Helena.
Okay, maybe I should go through the list here. Okay, Councilman Meyer.
Yeah, I understand. I guess I was just trying to just highlight that the rule in the emergency order, like I assumed, I kind of assumed that it was from the attorney, and the language in there, it was a little hard to read. So I was just maybe hoping that when we do put out the public, and it already has from my understanding, I'm seeing it, that it says it in a little bit different wording, so people can see the legal rule of it, but also just like wear a mask, when you need to. In the downtown settings, I would assume that is anywhere where you can't stay at least 6 feet apart, grocery stores, post office, all those settings are very good places and mandated to wear a mask now, or a facial covering. And kind of on the topic of educating the public about cleaning them and keeping them clean is good. I would like us to try to have resources of purchasing masks. I know there's some people in the town that have ordered some manufacturing masks, and those are a way to get some. We have a lot of people in this town sewing masks, but we really need, each person needs to have, I think, at least 2, so you can wash one and also have a dry one ready to wear out in the public. So anything that we can do to get our supply of cloth masks up, I think would be helpful for this order, so people aren't attacking someone that's not wearing it, because they may have a medical condition where they can't wear a mask. But if we have easy tools for them to get a mask, someone say, hey, do you have a facial covering? Do you need one? Here's some resources to be able to get you one, rather than attacking.
Okay, and there's another councilman trying to jump in there. Is that Councilman Gard?
Allison.
Councilman Ellison.
Yeah, I guess just a general comment regarding all of that stuff. I think the crux of the whole issue is that the council, as part of the policy group, is part of the management team, even though there's no line that directly connect us. We're certainly a box on the chart. And it seems like sometimes various components of us get to feeling like, or it seems like we're not all part of the same team. That it's us competing against you, and we don't want you to find out about this because we're going to do this, and you can find out about it later. I think we just need to be communicated with all the time. When things are going to go out to the community, we need to be told about it because we're the first ones that get an email or a call from the public saying, "What is council doing?" And it wasn't, council didn't have anything at all to do with the decision. So we just need to all remember all the time that we are all part of the same team and we're part of the town. So let's work together.
Okay, Councilman Gleason?
I guess the only thing I would say is I would like it to have in there that there is a $50 fine also if you get caught without one. And I don't know what the tactics are in there, if there's going to be some warnings or whatever, but I think we should be publishing those with our rule so that people can read everything they need to know. I do like what Councilman Schaefer said, that you need to know that you have to wash that after you use it. And so if that stuff like that was included in that, and they could read it all at once, so, and I think that's kind of what everybody's saying. So that's what I got.
Okay, Councilman Garden?
I think everybody's covered my concerns. Thank you.
Councilman Schaefer?
I don't have any more to add right now. Thank you.
Councilman Sherman?
I think it's good. I think the PIO portion of the IMT can help clarify and get the information out. I think Vice Mayor Meyer had a great point of maybe having a source or making some available other than the ones that are being handmade. And that's all I have. Thanks.
Okay, Councilman Baylor?
Well, I want to thank Holly for clarifying that because I kind of like to fall back on policy, and there is a Annex L, it's the pandemic influenza, and that's the plan for this happens. I'm assuming they drew this up not expecting it to be over in a week. You mentioned that these are long-term things. So now that I know that this is not a concern of council, we're not going to follow that, I'll put that away and won't have to worry about it. But I'm just curious if you even read it. So we'll move on. And I'm not in support of this ordinance the way it's written. I'm in support of the spirit of it, but I just think it's poorly written and leads to some confusion. It could have done better, but that's just my opinion. Thanks.
And just to clarify, where council fits into this is that I get to make the rules, incident command team, but your role is to repeal them. So if you are unhappy with the rule at any point, including this moment right now, you can say, nope, we're not going to do this at this moment in time. We want an opportunity to make a change. And that is your prerogative as council.
And if I may, the big issue that I have with that is you're taking out the public input part, and we're not in an emergency right now. We're preparing for one, and I think this could have gone through the public, as we were requesting this 2 weeks ago. So, but that's just my feeling. Like I say, I'll put the book away. Thank you.
Anything else?
Mr. Mayor, this is Melina.
Councilman Meyer?
Kind of just going off of what Mr. Baylor just said, I would like a little clarification on the Cordova emergency plan. I would also be curious if Holly has read it, and we have deviated from it a little bit, and there is a section for the pandemic. I know that I've read through it. The beginning part too also applies to this situation because it applies to all emergencies. And there's another section just for a pandemic. And I think there's a lot of really good things in there to prepare for this. And I think we have been following it to some extent and have deviated it in other areas, which I think can be expected in an emergency. But I would like us not to maybe put that book away because it was planning for a pandemic. So some clarification on the Cordova Operation Emergency Plan would be nice to hear from Holly and from the Incident Command team.
Paul?
Yeah, it's the plan, the EOP is a guide for us. That's what makes us move. And it's really nice to have. No, don't close the book on it. Leave it open and read through it and work through the process. The reason why I did bring up the state mandate being changed on Friday is that our team is actively working on all the mutual aid agreements with all the small businesses and large operations. And we have yet to receive a lot of the local business agreements. And that's one of the processes, and that was put in a rule that they have to agree to our rule. And a lot of the businesses aren't doing that. We haven't received a lot of them. We are actively working on the harbor plans and the boat plans, and we're receiving those from the state. And as the boats come in, we do see those plans and we do see the updates, but it's the local businesses that haven't turned in their plans. So I just wanted to make that aware for the council to understand. And the other reason I bring up the restaurant part and the social distancing is I wanted council to have a little bit of input on that and how that policy looks for us to turn around and put that out to the public as information, and also the enforcement aspect of it. So I'll leave it at that.
Holly?
Yeah, I mean, I definitely agree with the emergency operations plan. I hope I wasn't suggesting you should put it away at all, and I think that's been followed. And there is the pandemic plan appendix or supplement, which from my review appears to be taken from a federal pandemic plan that came out in 2005, which is a great resource in and of itself. And I think the city is following that. It's the reference to the policy group and what that really means that is not detailed or explained in a way that is that helpful to council, because there hasn't been a need and there's a different, and that part is in the, I think it's in the 100 pages of the emergency operations plan, right? It's in the beginning part. So for that reason, that is what I am saying, is they set up a structure and they give you an organization, but they don't give you enough details in the plan to really wrap your arms around what these roles are. And I think part of that is because the plan is, it addresses numerous different types of emergencies. So, but no, you do want to read the plan, be aware of the plan, and I think it'll bring you comfort to see how well your team is following it.
Okay. Any other final questions for your incident commander or the incident management team report? Okay, hearing none. Do we have a CCMC Authority Board?
Yes. Can you hear me, Clay?
Yeah, we have you on the agenda for a report here.
Okay, great. Hopefully I won't take too long. The staff has been busy trying to get equipment and PPE supplies and try to prepare for this new world we're entering. And just want to let everyone know, and I'm sure council is aware, that we've got an old facility that needs a lot of tending to, and to prepare for something like this is a bit overwhelming, and our wants and needs and list is pretty big, about $1 million. And some of the things on this list, we can get by with and don't really need. but just to let you know, just one item on here that came to my attention. It's $43,000 for a call system. So I asked about that. So in your room, if you're a patient and you need something, you press a button and it goes to the nurse's desk and it alerts them that you need something. Well, our system is down, and we're essentially using cowbells. They're ringing a bell, and then people are hearing the bell and coming to it. But that's just one example of our facility is in need of some equipment, and we are out getting donation and fundraising. In fact, just a few minutes ago, I got a $20,000 donation from Copper River Seafoods, and which is nice. And of course, we got the EAC Corporation donation, and we're working with NVE to do the purchasing on that. We received a Murdoch grant for $50,000, state grant for $90,000, Alaska Community Fund for $20,000. We're going for a $100,000 USAC grant for IT and telemedicine, and then a Rasmussen grant for $50,000 to $100,000. We're hoping to get some of that, and FEMA monies too. And good news on the SBA PPP grant. We're supposed to get $1.154 million deposited into our account today. So that's going to help us immensely. And then another thing to keep in mind, our revenue is this month is down about 15%, and I assume it's probably going to go down this summer. People aren't coming in for elective stuff, and anyway, that's just part of dealing with what's going on. We're not the only one experiencing lower volumes in traditional medicine. So anyway, we're working on trying to get money and trying to get the facility prepared. So that's all I've got. Got some questions.
Thank you, Chairman Meyer. Any questions, Council? I'll just use an open format if any of you have a question. Okay, thank you, Greg. Sorry. Okay, Councilman Meyer and then Baylor.
I just wanted to ask a little bit about the grant, excuse me, the SBA loan that you got, and what can that be used for? Because I think there's some speculations on what you can use it for, and then,
Yeah, we're getting the, I want to see it in writing before we start using it. But basically, it's a loan, 1% loan, 2-year loan. But if you use it for payroll, rent, utilities, specific needs, it'll be forgiven. So it'll turn into a grant. And we need labor is one of them. You have to spend 75% of it on labor, which for us that's easy. And then you can spend another 25% on other things if you want. Or you can put it all into labor. We're not going to have any problem at all qualifying for this. Our payroll is $300,000-400,000 a month. So this will be welcome money.
Okay, thank you. Councilman Baylor.
Yeah, I just wanted to thank you, Greg, for what you're doing behind the scenes there. That's outstanding. And you get some great results. And then I'm hoping at some point we can address the issue of the testing cost. I think we should be able to figure out a way for those that can't afford the testing, that we can maybe swing that somehow between the hospital and the city. So thanks for everything you do.
You bet. I agree on that too. So we'll work on that. And thanks.
Other questions, Council? Okay, thank you, Chairman Meyer. Appreciate you calling in. Do we have a school board online? Alex or Barb? Okay, hearing none. We have an audience line set up?
Yeah.
Okay, we do have an audience line set up. That number again is 424-6202. I'm sorry, 253-6202. and you'll go to on hold. And then as we pick up, remember to mute your YouTube in the background, please.
No? Yes.
Okay, you're online. If you could state your name for the record.
Hello, can you hear me?
Yes, we hear you.
Okay. This is Kathy Rentfeld. I'm calling on behalf of the Cordova Chamber of Commerce. I want to thank the IMC and the City Council for the roles that you both play in managing this crisis and trying to keep our community moving in this unprecedented time. As the voice of the business community, I just want to urge you that whatever decision is made by council or the IMT regarding the reopening of business is made soon, and that language is clearly communicated to the business community, and the Chamber is here to help as a vehicle for that message.
Okay, thank you. If that's all, Kathy, if you can hang up, then it'll allow other callers to call in. That number again is 253-6202 for audience comments. Okay, you're online now. If you could turn YouTube off and state your name for the record, please, and you have 3 minutes.
Yeah, this is Carl Becker. I'd like to read my letter that I sent to you. I had a couple of additions. Thank you all for your hard work and for this opportunity to express my views with the goal of protecting our community from the unfortunate consequences of exposure to COVID-19. I appreciate that you and other residents may have already raised these issues. Again, thank you. I think that we can compare our town to a cruise ship. The close proximity of people in the fishing industry, fishers or cannery workers, can lead to a widespread contamination by one case of COVID-19. Remember, this is not the flu. It is 10 to 20 times more deadly and doesn't respect age. People can be infected and contagious without knowing it. Most ICU patients on ventilators die. Survivors of COVID-19 can face a lifetime of complications such as scarred lungs and damaged kidneys. Are we ready to allow ourselves, our families, our friends, visitors, medical providers, merchants, seasonal workers, and fishers to risk this outcome? I'm not. We should take steps to avoid these outcomes. These would be a start. 1, businesses, agencies, and medical facilities in town must ensure that everyone wear a mask before entering the premises. Wearing a mask in public spaces is a matter of personal responsibility and public safety. When we enter a business wearing a mask, we are showing respect and concern for the people serving us by protecting them if we happen to be infected. 2, we must adopt a zero-tolerance policy toward any case of COVID-19. If one case appears, fishing must be suspended pending testing and contact tracing to determine if there are any other infected individuals. The testing must be free if it is to work. The fleeting canneries must act responsibly to help us prevent any case of the disease. While unpleasant, there are precedents for interrupting fishing, including strikes and the oil spill. Representatives of our city government should contact the agencies responsible for the fisheries to implement this policy. 3, all returning members of the fishing and processing community must quarantine for 14 days. A separate area of the harbor must be set aside for fishers quarantining on board their boats. 4, the recommendations must be enforceable. 5, we can use the Wednesday tsunami warning test to remind people of the city guidelines to prevent any further COVID-19 cases, And 6, we should remember to socially distance, wear masks, wash our hands, and don't touch our faces. Thank you for the opportunity to weigh in with these suggestions. If we do the right things, we can make it through the fishing season unscathed by this terrible disease. Thank you very much.
Okay, thank you, Mr. Becker. And I'll have to admit, I forgot to start my stopwatch, and if you got more than 3 minutes, it wasn't intentional. So we appreciate your written comments as well in the record.
Yeah, I think I got those under 3 minutes.
Okay.
Thank you.
Great, thanks. Okay, caller, if you can state your name for the record and 3 minutes.
Yeah, hi, Bob Smith, 702 Lake Avenue. I listened to the workshop and I listened to the rule that you guys are, the rule doesn't make any sense. I'm totally in favor of mandatory mask wearing in the business district or high traffic areas and make it enforceable. This one, I don't see what you can even do with it. Of the 5 cases that I'm tracking on the quarantine, we've got to make this quarantine real. Not one single individual has ever been followed up on to see if they need help getting groceries or if they're observing the quarantine. Yes, and as far as the harbor goes, I know you guys got a letter from the Coast Guard saying that they are prepared to help. And, you know, I got boarded by the Coast Guard 10 times last year. They told me to get a life raft. You know what I did? I got a life raft. So we need to start using our resources and make this quarantine as good as we can possibly make it, because I don't see anything happening with it now. Thank you. I'm out.
Thank you. Caller, you're online. If you could state your name for the record and 3 minutes.
Hello, this is William Deaton. Can you hear me?
Yes, we can hear you well.
Wonderful. I'm calling about the restaurants opening up. I know that's not on the agenda. Is that all right if I speak about that this time?
Yes, it's audience comments.
Okay. I don't see the argument that we have a bunch of people coming into our community so we can't open our restaurant. We already have a 14-day quarantine required for all people coming in. Even if you're an essential worker, you must quarantine when you are not working. So I don't see that argument. I think that the restaurants can open up. I don't see why they can't. If they cannot open up, I think that we should see why they cannot. And the argument that those people coming into town, the commercial fishermen, the cannery workers, they're going to be under quarantine for 14 days, so I don't see why they can't open up. I know I repeated myself there a few times, but that's my comment. Thank you so much.
Okay, thank you. And just for clarification, that item wasn't specifically on the agenda, but council did amend the agenda to include a COVID-19 policy discussion, and that was one of the items that came up earlier in the conversation. So we don't have any callers online, but Dr. Sanders, are you still online? Okay, I was going to read her letter into the record as part of the audience comments because council had requested, I think, in the last meeting there. So this is her medical update as of April 15th. Dear Cordova, I wanted to take a moment to update you on the medical preparations for the potential outbreak of COVID-19 in our community. CCMC and Alaka have been working collaboratively to provide the best medical response possible for Cordova. We've provided input to the incident management team on recommendations for processors and fishermen to reduce the likelihood of COVID-19 in Cordova, and if it does occur, to limit its impact. We've obtained testing equipment and treatment supplies at both Alaka and CCMC to be ready if cases do occur. We now have rapid testing available at both Alaka and CCMC. The rapid testing is not approved as a test to screen healthy individuals. The test is used for people with COVID-19 symptoms. Test supplies are limited, so we will need to be judicious in who we test. We'll continue to follow the Alaska Department of Health testing guidelines. We're developing and implementing treatment protocols to include quarantine and medical plans. We have bolstered our oxygen supply. We are looking at emergency staffing needs and backup plans, coordinating with all healthcare staff at Alaka and CCMC. Although we have not had positive tests to date, it does not mean that there is no virus in town. Many people, particularly young people, do not have symptoms but can still pass the virus on to others. In this light, you can help stop the spread of the virus by assuming it is present and taking appropriate precautions. These include wearing a mask in public, frequent hand washing, and maintaining social distancing when out. The disease attacks the elderly and those with existing medical problems harder than others. Please assist your friends and neighbors with those issues by doing their shopping and errands for them. Finally, if you know people coming into the town this spring or summer for whatever reason, encourage them to follow the 14-day quarantine and not leave their residence to go out to stores or common places. Please continue to follow Cordova mandates and guidelines. We thank you for your support during this crisis. Best, Hannah Sanders, MD. Okay, Council, let me get back on my agenda here. We didn't have any other more audience participation, so that was audience comments regarding agenda items. We have reports of officers. I don't have anything to add as mayor's report. I think I did my updates in the course of the discussion. Manager's report.
I have a couple of things. Obviously, we have a new mask rule that went into effect, and I just want to make sure we're all still comfortable with that rule at the moment. If there's any council action that needs to take place, it goes into effect tomorrow morning, so would love for that conversation to come up and just really understand direction there. The governor made new rules last night, which are relaxing the opportunity to eat in restaurants and other things. And as we discussed earlier, we're going to keep the course that we have here. We're going to have to modify a few things because our mandates say we are going to follow the state mandates, and obviously the state mandate is not what we want to do, at least in those instances. So we'll get that figured out. And there's going to be a new fisherman's rule that's going to come out, mandate probably today, maybe tomorrow, and it will change some of the rules about how fishermen engage in our community on their vessels. And so we're waiting on that, and with any luck, hopefully most of the governor's mandates are now going to be on the table, and we'll have a little breathing room to really solidify all of the things that we're trying to accomplish. Because needless to say, whenever there's a new mandate, it causes a bit of a disruption in how we are approaching things. So just so the community knows, we are responding to state mandates which take priority over what we do here, only insofar as if we don't follow the state mandates, as a small community, we can make adjustments, but we have to make those adjustments, otherwise the state mandate rules. So we're working fast to try to make sure we have everything in place there. Non-COVID related news. I actually have something to report, I'm very excited to say. Two things. The harbor, we are submitting a build grant to the federal government. It's going to be a $25 million grant to hopefully redo this entire harbor here. We submitted last year, we weren't successful, but if at first you don't succeed, try again is our mantra, and we're strengthening that document, and it'll be submitted within the month. And the only other thing I want to draw your attention to, which is COVID related, I guess, we are getting a distribution through the CARES Act of about $3.4 million. It's been announced. We haven't gotten any of the documentation indicating how we can spend those resources, but that will be a council action and decision in the future. But it is good news, gives us a sense that if our fish tax revenue doesn't come in as we expected, or sales tax revenue doesn't come in as we expected, or we have additional costs related to COVID, that we have some resources to cover that. So with that, I am done.
Are there any questions, Council?
Yeah, Clay, this is Councilman Gleason.
Councilman Gleason.
Yeah, I also listened to Dunleavy's press conference. He did say that small communities can do what they want in that. Are you saying that we have to have something sorted out before Friday?
Well,
or we have to follow the mandate?
Right, so, and it's going to be a simple language change in some of the things. Holly's working on it now, but we're waiting for the final language from the state. So he made an announcement. He generally spoke about certain things, but we're waiting for the document that says this is what we're doing, and then we'll figure out how it integrates with what we already have in play. As I say, some of the mandates that we have basically said we're going to follow state rule. So state rule changes, state law changes. If we want something different, we have to articulate what that something different is and make sure it's clear in our rules.
Okay, and then the other thing is, are we going to be setting a meeting up either tomorrow or the next day to discuss the face masking? Because it has to be on an agenda, and it has to be, public has to have a chance to weigh in on that. So what is?
So as it stands now, this is a rule that I am putting in place with the incident management team. It will go into effect tomorrow morning at 8 a.m. If you don't want that rule to go into effect, you can repeal it today, and then we can put it on the agenda for discussion for next week, or if you want to do another special session around it. If you want it to be, if you want me to modify the rule, you can give direction to that, and you don't have to go through the public process that council normally does. But if you want council feedback, community feedback on it, it probably would be best to just let it go on next Wednesday's special session meeting for council approval. We can put out, we can have a work session with direction if you want, and we can put that forward, and you'll have opportunity for public feedback and then take action next Wednesday.
Okay, yeah, that sounds fair enough. And in the meantime, it'll be implemented tomorrow, and I don't think it's going to do any harm to have it implemented tomorrow, as long as if we can come up with maybe a little bit better wording, just so everybody understands it and.
So again, the rule is presented to follow the legal guidelines. It mirrors the rule that is in Seward and other communities. So, but if you feel like it's unclear, we can communicate it in a different way. We can say, you have to wear masks on the docks at all times, instead of if you're on the ramps and this and that. We can be clearer without breaking or changing the rules. So if it's really about how we communicate it, that's different than the intent or what the rule says. So let's make sure that if it's strictly a matter of communication, that's easily solved. If it's the rule itself that it doesn't go far enough or it goes too far, we can make a change, and that's your prerogative as council.
Okay, thanks, Ellen.
Other questions, council?
I had one quick one.
Councilman Garden.
Yeah, you just stated that we were getting about $3.5 million as a city, and Greg had talked earlier about the hospital getting 1.5. Are these two separate pots of money, or is the 1.5 the hospital's getting included in that 3.5?
Two separate.
City getting?
Two separate.
Thank you.
Councilman Baylor?
So in regards to the restaurants, I would encourage you to maybe contact the restaurant owners. We only have a few of them here, and even if the governor said so, it's not likely that they're going to run out the next day and open up their bars. But have a discussion with them, and there may be a way that they can open up their doors in some fashion. Like I said, outdoor eating, and that's something you'll have to run by the medical team, but from what I've been reading, outdoor eating is fairly safe. Maybe they can come up with a plan to keep their doors open, keep a little income coming for them, and safely do this. If not, then, that's the way it goes. But I think these people should have a little bit of input and say, and if maybe they can serve the public in a safe manner. We have a lot of pop-up restaurants, wagons, whatever you want to call them, coming, and that it would be a simple matter of keeping 6 foot away from the person standing in front of you, and whether they can eat outdoors. So I would encourage you to at least talk with the restaurant owners, and I think it's always best of all of these things, mask and this, it should go out for public input. We're not in a we have to act now mode right now. We just have to plan and keep things moving forward, and we're meeting once a week. So, thanks.
Other questions or comments, council? Of the manager? Okay, city attorney report, Holly?
First, one thing I like to emphasize, I hear council talking a lot about some very good ideas, some very important ideas about how you want to restrict access or not, and can always take another mechanism as a policy group, but also just as city council. One of the approaches I've taken in some communities is we have adopted ordinances that implement council rules and also incorporate comments that are also published alongside those rules. Sometimes, for example, if you're going to close an entire, let's say you were going to prohibit hair salons. We didn't have to go there before because we followed the state's rules. Now, when you're looking at things like that, if you want to go there as a council, that's a very appropriate discussion for council to have, and it's a very appropriate area for you to. You just would not be using the same emergency rule procedure the city manager and the emergency response team uses. You would use a resolution or an ordinance, depending on what you wanted to do for enforcement. So I want to throw that out there because I feel like I don't want council to feel stifled. It's important that you know you have the tools and that you can engage in that conversation and make those rules if you decide you want to do that. So I just want to make sure that that's clear for all of the council members.
So Holly, I have a concern because we're 2.5 hours into a council meeting. The incident management team only met for an hour this morning to go through all the business and things they had to work on. They've got lots of information. For instance, airport traffic is increasing sharply this week. So that makes a mask ordinance, in fact, very timely right now and important. But all those little nuances that go into the decision-making on the incident management team on the council side, I'm just trying to reconcile what the roles are. And I think I heard you saying earlier that council can add to something, but if council, for example, wants to overturn that, then that's a mask rule. Then they can do that as part of the regular process or as part of that five-day response.
I mean, I think of it, your emergency team has to be able to move quickly, and it would be very damaging for the city if city council could slow that movement. But city council doesn't necessarily have all of the pieces of information, like you're saying, that go into those decisions. Those decisions are required to be necessary to protect the city to preserve the city's health, safety, and welfare. So they are operating in that way, and there are these mechanisms for them to do it quickly. So that's one line of action, right? And so that is why the city manager and the incident management team adopt rules, and council has a chance to say, whoa, we don't like that one. But council moves regular speed. So council does not, now it may do an emergency ordinance, but it will still stay within the confines unless it really has to, right, of the timing and the public notice and the public process that it usually adheres to under the Open Meetings Act and other laws. So what that means is if council wants to engage in this discussion, if they want to weigh in, or if there's a matter that has such a significant impact on public due process rights or their liberty interests or economy, and it's a very important piece, then council can go through that using their own rulemaking authority. But what we don't want to do is confuse council's role with the incident management team's role, because council will move at a slower pace, and the emergency management team needs to be able to move as quickly as possible. So the mask rule generally could go into place immediately, because every time someone puts on a mask, perhaps that's one less person that gets infected, right? We're in at the middle of everything is urgent. But so, you know, as a matter of policy, when we're looking at this as a matter of general ethics and culture, we don't want to do that. We don't want to require masks, or we want to have it sound different. We want it to be a simpler rule or a broader rule or whatever the scope may be. In that sense, council doesn't amend rules that the city manager puts in place, because there needs to be control from the incident management team over the scope of those rules. But they can repeal it, and council can come up with its own rule if it wants to. And what we would then have for the city is, here are the full and city and emergency operating team rules and procedures. And they're posted, they're both available, and they work in harmony together, just like you have statutes for the state of Alaska and regulations, right?
Okay.
So they work together. Yes.
Okay. Let me go through the roll here. Councilman Gleason, was that you?
Yeah, it was.
Okay. Yeah.
I wanted to say to Holly that, you know, none of us want to eliminate having a face mask rule. I think everybody's pretty much on board with that. If this had actually been on the agenda today, it probably would have solved a whole bunch of issues. So our problem is, you know, we have to set up meetings every time we need to change something or add something or whatever. We have to set up another meeting. We have to publicly notice it. It could have been solved by having this as an agenda item. So I do think that this, even though this is a rule that Helen's allowed to make, it still impacts the public in a huge way, and it's a huge step in making the public safer. So it's a big deal to me that it wasn't on the agenda, and I think that stuff like that needs to be on the agenda so that we can make, you know, have discussion and possibly change some stuff and keep things going rapidly, but doing it in a smart way. That makes sense.
No, that makes a lot of sense, and I think you can do that. I mean, one of the directives you can suggest to the city manager, the operations team, that when there is a rule that can be put before council prior to adoption, that those rules come to council for repeal prior to enactment. And I think so long as you don't demand that, for lack of a better term, so that they maintain that validity and flexibility for the rules they really do need to enact immediately and swiftly, I think that sounds like a great policy. I think that would be fine.
Okay, thanks.
Okay, Councilman Ellison for attorney.
I got nothing for all.
Okay. Councilman Sherman.
No questions. Thank you, Holly.
Councilman Meyer.
No questions. Thank you, Holly.
Councilman Gard.
Yeah, there's no reason that this enactment of the face mask rule today by management team at all impacts the regular input we can have on it. If there are things that need to happen rapidly, they can happen. If we want to sit down and discuss them in a public forum and get all the input we need to modify or repeal or add to or do whatever we need to do, that's fine. One's not exclusive of the other, so there's no reason that the rule shouldn't go into effect as written. I don't think it does any damage, and we're fine. So that was my only comment on that.
Okay, Councilman Baylor.
Yeah, I think just for clarification, the mayor spoke that, but actually, I think Councilman Gleason brought this issue up 2 or 3 meetings ago, that we need to, actually tried to get it on the agenda, the whole mask thing, because I think all of council realized that that was a direction we needed to get to. and we were hoping to get it on the agenda and run this through the public. So we did ask for that, or I shouldn't say we, Councilman Allison, or Gleason did ask for that. I don't know, the city clerk can remind me, but it was a couple meetings ago. So it's not like we're like, oh, shoot, we got to get this today. We were trying to get this well over a week ago. But again, I just reiterate, I think if you have to move fast, you move fast. But if not, it's always best to get 7 people in the community looking at these things. So I support the mask. I don't think it's written very clearly, but we'll move forward from here.
Hey, Councilman Schaefer?
I don't have any comments right now. Thank you.
Okay, thank you, Holly.
Thank you.
So we have correspondence in the packet. Is there any council comments on correspondence? I'll just leave it open.
Other than the fact that if they're not signed, I just delete. So I appreciate the letters that come in and people do sign them.
Other comments on correspondence, council? Okay, so we'd amended the agenda to include an item 12A, which is a discussion on COVID-19 policy. Did I get that right, Councilman Meyer?
Yeah, and I was going to go ahead and talk since I asked for this to be on there. I know that we had a lot of discussion throughout the court and the joint meeting that we had with NBE already, but I think that this, just moving forward, that it's really good to have this as a placeholder for council to be able to bring up any other concerns or ideas. Kind of like when Baylor was talking about the mask thing had been brought up, but maybe if we had this item on our agenda, then we could have got currents on it, put it on the agenda or whatever that we needed to do. I just want to bring up too is the kind of coming from the work session about hiring some more people, community safety officers, or sorry if I messed with the name, I should write it down. But I think that would be a good direction for us to go in, and if policy needs to be brought to us or if council needs to bring up the policy on the increased budget for these temporary workers, I would like to see that sooner rather than later.
Okay, Councilman Allison?
Yeah, the same thing I had said before. I guess I think the sooner we can get to having the same rules as the state has, the easier it is for everybody to understand. It's not just for restaurants; it's other businesses too that are shut down that can put in adequate safeties. This mask thing is not an emergency by any stretch. We may have a bunch of people coming into the airport this week, but all of those are 14-day quarantine right away. I think you're going to get a lot of people that have PTSD or whatever they're going to say they do if they get busted for not wearing a face mask. They're going to have some medical excuse for not wearing it. So it's going to be awful hard to police. The people that are going to do it are going to do it. The people that aren't are going to have contaminated masks anyway. So I just disagree with that policy, but I'm in the minority here, so I'll go along with whatever the majority of the council says there. But I think as soon as we can get to the same rules as the state has, the easier it's going to be for everybody. So that's where I'm at right now.
Councilman Baylor? Councilman Sherman?
Having such a hard time with all of this. I guess I'm okay with the mask ruling, and I would like to see. I don't know if we're going into tactics or whatever, but if there is budget issue or something that needs to happen for the community service officers to get into place as soon as possible, I think that would be good, and I think they should be useful to watch for quarantine, to walk in the harbor, to be at the airport, to be walking the streets of town. So again, I say as many as possible. And if I'm following the process right, and we're going to be deliberating or discussing whether or not to remain status quo on the restaurants and other community businesses, is that something that council can discuss at next week's meeting, so that there could potentially be, again, public comment? And if the rule is already in place, like this week's case, can we make sure it's on the agenda for next week? That's all I have right now.
Okay, Councilman Gleason.
Well, I feel like we're waiting a long time meeting next Wednesday, but it's not. I wonder. I would love to hear from the restaurant owners and other businesses, non-essential businesses that would be opening up, on what their opinions are of that. I'm not a big fan of foot traffic in the grocery stores or any other store for that matter, because I do think that there's a big danger of, it's spreading, like especially with incoming fishermen. And so most people are asymptomatic and they don't even know they got it. They could spread it just as bad as people that actually are sick. So the other thing I'm concerned about is our 14-day quarantine process, whether it's in the harbor or on their boat somewhere else. How do we know we're going to have flagging in the harbor, but do we check on those people? Do we say this is when your day starts and you have to do this until this 2 weeks later, and if we catch you, running around doing other stuff, then you're in trouble? How does that work? And that's, I'm sure, in the tactic area, but it's a big concern that people are asking me. So I may get reprimanded for bringing that up, but I'm just saying that's the question I'm getting asked, and I don't have an answer. So maybe Paul can speak about that, and that's all I got.
I think Helen can speak to that.
Just two points. I will agree that there is not a plan in place or enforcement in place to identify people when they come into town, the exact date, and when they are out of quarantine. I'm speaking specifically of people arriving and living in Cordova. So you come back from a vacation, you're coming to town, you're living in our community, in your own home, wherever. The harbor is a different story. People are going to know when the boats arrive in town. They're going to check in. They're going to check in either with police dispatch or with the harbor master, and that information will be collected. The harbor will put in place quarantine flags on those vessels that are in quarantine status. And what I have been led to believe, and I'm sure it's true for those of you who are fisher folk, that most people are going to get in town, get themselves on their boats, get them loaded up, and they're going to get out and they're going to start fishing, and they won't be in the harbor for 14 days. So that is what we're expecting will happen in reality. But the fact of the matter is when you come into town, if you're driving your boat in or if you're working on your vessel, harbor master and his crew will be walking the docks regularly, identifying the boats that are new to the harbor or individuals that are new into the harbor whose boats are getting activated, and flag them. So we will have a very close knowledge of that when the quarantine starts and when the 14 days is up. As far as the rest of the community, don't really have a way of tracking that.
So Just to be clear, that's for residents coming back, say through the airport, but anybody coming into the airport for fishing and whatnot, they're filing those forms. We're collecting those. Please have those on file so they know when that 14-day quarantine starts.
Right, but we don't have a way of, we're not tracking their movement in town.
Yeah, no, we're not hounding them.
Yeah, right. The harbor's a different story. We can keep track of that better because it's a contained space, and we know the vessels and the folks that are working on them.
Mm-hmm. So does that help, Councilman Layson?
Yeah, I'm glad that I'm just glad that she has an answer for the public, because I get a lot of calls about that. So hopefully that is a good enough answer for most people.
And can I just speak to one more thing about the harbor? With snowpocalypse and any of these big events, when you have snow piles and big heavy equipment, you can see the response. And I think what people are waiting for in the harbor is to see bright red signs, yellow flags, hand washing sinks. All of that stuff is going to be put into play in the coming week. There's a lot of things that are happening. Signs are being made. Things have been ordered, and we're really close to having a visible response in the harbor for those people in the community that have been waiting for it. It has not been that we aren't doing. It's just that things have not yet arrived or gotten in play, but they're well underway.
Councilman Guard, Schaefer, then Baylor.
Yeah, I have no comment at this time.
Councilman Schaefer?
Yes, thank you. I would also, like to see if anything needs to come before us to get those community safety officers hired. I'd like to see that as soon as possible. And again, this might be getting too into the weeds, but the safety officers, in addition to trying to enforce the different mandates, could also serve as public information officers, have information answer questions to the public when they're out and about, have masks to give out if they're needed, and they might be able to help in the harbor, like with some of the quarantine, keeping track of, who's moving where. I'm just saying, if we are hiring this group of people, we should put them to use wherever we need the extra hands, so as many as we need. And then as a policy standpoint, I'd also like to continue pursuing testing as an option. I mean, I know we got the rundown from Dr. Sanders today that some of the tests aren't appropriate for Cordova at this time, but just keep that avenue open as new tests become available or as different options become available to us. And continue to increase public information and education. I think it'd be great, like Helen was saying, people are waiting to see the visual response, and so signs everywhere with the different mandates and reminders about quarantine and social distancing, I think would be good. And I'm in support of continuing as we are in terms of businesses staying open, although I do agree that it wouldn't hurt to have a conversation with local businesses and to see if they could operate, how they could operate differently if we were to sort of gradually open. But as it's come up before, like we haven't even begun to have to deal with this issue yet. We don't have the influx of people in town yet. And so we're still preparing, and it seems counterproductive to be easing mandates before we've even had to deal with the problem. So I think it's in everyone's best interest to continue as we have. If it starts spreading in the community, the more people moving out and about, it's going to spread faster, and that will affect the fishery, for the rest of the state. So I think it's in everyone's best interest to continue as we are in terms of the businesses being open. And that's what I got. Thank you.
Okay, thank you. Councilman Baylor?
Yeah, I guess that Councilman Schaefer's comments is exactly why I think this should be a public forum to discuss that. There was a lot of information there, and the public should weigh in on it. So, Mayor, I guess I would recommend that you kind of summarize this meeting. There's been a lot thrown out here. I think direction or suggestion, how you want to put it, about enforcement was there. I would like to hear that what message the incident command team has heard, so they know their marching orders, or if we got any, because sometimes we say we're waiting on this, and is the manager clear of any direction or suggestions that we gave before we walk out of this meeting, so everybody understands kind of what we're talking, because a lot of information was talked about.
Yeah, so I think I heard from and correct me or fill in the blanks, I'll just make a list here. I think I heard a policy direction from council to enforce the rules and mandates. And the general shape of that is use the resources. If you need to hire additional part-time staff, then, you know, don't wait for council to give you, you know. So anyway, that's what I heard is if you can go ahead and start enforcement in general and look at that option of bringing on part-time help to execute that, and don't worry, you know, we're in a position to approve that, or we want to approve that and make that happen. So during the discussion with the tribal council, I think we clarified the legal questions, and kind of holding pattern there was really around the airport access, and that's fairly clear. But then it comes down to policy direction is for the tribe and city to work together to not duplicate efforts, and to look at the incident management team structure to proactively and actively fill those positions, and incorporate Native Village of EAC staff where appropriate, and provide the training, or proactively work towards training those people. I heard on the pending agenda, and we're getting to that soon, that, and you can discuss that on pending agenda, but to include this COVID-19 policy discussion on the future special agendas. On the state mandates, relaxed state mandates, restaurants being one of those, I think, to have a discussion or try to work with our local restaurants to see what that might look like. I'm just going to mention that part of the problem is there's so many rules and mandates, and communicating those details to the public and what is and isn't. And I really encourage council and the community to look at the new website, because the infographics and the plain, simple presentation of those things really help. But for example, right now, there's nothing in the mandate, from my understanding, that somebody can't order out from a restaurant, walk right around to the picnic table and sit there and eat it, because they're obeying the social distancing rules and so forth. It's dine-in that isn't allowed. So there's things right now that are already allowed if you want to buy something at Baja Taco and go sit at a picnic table, as long as you are social distancing and following the rest of the rules. There's nothing that prevents that right now. So it's hard for all of us as a team to, you know, process and manage all this on, you know, on a time scale. But that's what I heard, is to put the restaurant as one. I was thinking of putting that as one of the policy items, actually, as the governor's mandates that are relaxed, and our response to those. By the time that happens, I think we'll still be within the 5-day window for council at Wednesday's meeting to repeal anything that the manager puts in place. I think I heard from Holly that the council couldn't put a wrapper on that to say, hey, here's this rule, an emergency rule. Council is just going to clarify and have this policy wrapper around it that, you know, these additional stipulations. And
Mayor Copeland, can Holly explain the 5 days? I thought I had 5 days to get you a new rule that was put in. I didn't know that meant you.
I think that's correct. Within 5 days, council had to be notified of a new rule, and then they can follow their policy schedule. Is that correct, Holly?
That's correct.
Okay, thanks for that
Remember,
clarification.
council can also, so the rule will get put into play. Council can then say, okay, we have these rules. We want to come up with a more global, comprehensive plan. And we have these rules that are governing conduct right now, so we are acting now. But we want to do something, and we're going to take a little time to do it. This pandemic may last. It may last a very long time. You know, we don't know. And so if council wants to do that, then that is sort of a different train. So it's beyond a policy wrapper. So they can do more. Council can do more than just, you know, so their role with the rules is simply to repeal it in that 5 day, you know, when that 5 day period is up, Susan has 5 days, and if that you want to repeal it, you can, and that's a check and balance on your emergency management team, right? But you also have your role as the city council, which is what do we want to do as a community, and then the incident management team can react to those rules if it's necessary, or they can just be harmonious with what's been adopted. And we can structure that. We can, and if this is confusing, if I'm confusing you and not clarifying, we can put an ordinance in front of you, or a resolution even, and what will determine what it should be is the nature of the right you're impacting. So if you're doing something very substantive that's going to have a very large impact, then I like to see that in an emergency ordinance because it has a public hearing. And that's the difference. That's when we use one rather than the other in this particular arena. But we can put one of those on your next meeting so that you can practice, so that you can see if that works, if you feel like that is a better tool to governing the pandemic in the long term in a way where council and the public are really engaged and involved. That is something we can do.
Okay.
Can I suggest?
Yeah, Susan.
So maybe we're meeting every Wednesday. Whatever has been put in place by that Wednesday meeting, let them ratify that entire set of rules that exist at that time. They may change by the next Wednesday, and we'll do it again. And if any of them were to want to repeal anything that were put in between that week, what is their way to do that? Because how would I to call a special meeting, I need 4 of them, which means at a meeting, 4 of them agree to a special meeting. So how would they repeal something within the week-to-week schedule?
Well, I think if that happened, I would presume it would be an extreme emergency, that the management team has done something that council is just completely opposed to, right? Or something that has immediate detrimental impact that can't be undone. And so I presume that's not going to happen, honestly. Your emergency team is put together in a way that it has its own checks and balances, and they're making rules often with the directive of council. But if that happens, then we would use this. That's why we have the emergency meeting trigger. So we would use that if that were to occur.
Yeah.
But right now, I think the rule goes into place. The council reviews it at the next meeting. They can repeal any rule that they don't agree with, and that permits and protects the integrity of the emergency response system as anticipated by the state. And that's what you see happening with with other communities as well as, and the state structure is a bit like that. The legislature does make determinations that would impact the governor's determinations, but they pretty much tried to stay away from that. But they did have a Senate bill come out that had some of those impacts recently. So it's the same structure. You have 2 trains.
Yeah.
The emergency management team train, and that stays and maintains its integrity, and then you have council. So I'm hoping that you are understanding that, because I don't want you to feel like you are not governing to the greatest extent possible, or that you want to, right? You want to make sure that you don't feel stifled in any way.
And I would just add, too, that the agenda process works as well for special meetings. It kind of fell through the cracks a couple of weeks ago because Councilman Glazen had called me and asked me to put the mask thing on there. I forgot about it. We were going to ask council to amend the agenda, and frankly, it just got away from us. So that was an anomaly, I think. But two councilmen or myself or Helen, and I think it seems like we're making a lot of sausage, but the working relationship here is really good. I mean, council, Helen put the emergency rule in place on finances. Council said, hey, we don't really like that one. She could have said then, well, hey, then do your policy thing and have an ordinance to overturn it. But I think it's a good working relationship. And so I think a better way to articulate what I was trying to say about the enforcement, what I heard from council was we want to see more enforcement. One of the tools that might work really well for you is these part-time employees that you had before doing kind of enforcement type roles. Don't wait for us from policy direction to do that. Go ahead and put that in place if you want to. And then there's that check and balance in place if council comes back and says, well, we really didn't like where you went with that. So that's what I heard on that. And I also heard from council that they want to see very visible communication and implementation of these plans and whatnot. And I think you just heard from Helen, and I've seen some of those draft signs, and they do include things like the signage and whatnot are mentioned on them. The volunteers and people at the airport are wearing fire department vests, so they are very visible, as Councilman Meyer suggested. But that's what I heard. And then amend this or include on this future agendas this policy discussion, specifically the governor's overturned mandates for next meeting. Helen.
Hi, I'm still slightly unclear. Maybe just bear with me here for just a second. So at this point in time, as it stands, the emergency rule that got put in place for the mask goes into effect tomorrow morning at 8 o'clock. We're still doing that and then revisiting it next week at the council meeting. Is that correct? Or did you want to, are you wanting to repeal it today and then revisit and put a new rule in place next week? It doesn't matter to me, I just don't understand.
They can't repeal it today without a resolution on the agenda to.
It's not on the agenda.
Okay, there we go. So it will go into effect tomorrow and you guys can discuss next week. Okay, then the only other thing, which I believe, unless there's direction otherwise from council, our rules will be in conflict with the state
As soon as he puts out his.
as soon as he puts out his rules. And if they go into effect on Friday, basically it says that restaurants could open and these sorts of things could happen. So I would like to put in place, again, we're awaiting the announcement from the governor, the actual mandate from the governor, but we would need to put in place something that says, okay, but we don't want our restaurants to open right now. We don't want our hair salons to open right now, and these sorts of things. I can prepare that and make sure it's in play for Friday when the state rule goes into effect, or by default, the state rule will go into effect on Friday if we don't have something to supplant it. And then you guys could have this discussion again next Wednesday, so it'd be a 5-day gap. So I don't know how you guys want to proceed.
Well, but then the incident management team has said we want these rules that are in place to protect the public.
Right, but I'm hearing that there might be some conversation around, I mean, I'm fully prepared to do that, to put to put something in place, get the language right so that we're not in conflict with the state.
I just want to make sure council understands the implications there. Yeah, Councilman Baylor.
I don't know, I'm not going to speak for everybody, but my opinion is, yeah, you keep the rules in place that we have. The 5 days isn't going to make a difference. Then we have the discussion, and at that time, hopefully we can have input from our medical team and say, well, no, this is ridiculous. You can't eat outside, or there is a way to work around it. We've had the discussion with people who own the businesses. I think that's the course that I was thinking of, is getting input from everybody, the community, restaurants. So that 5 days that we keep it, our mandate isn't going to stop anybody from, isn't going to harm anybody, financially.
Yeah, so then I would go ahead and make those changes so that the state rule doesn't preempt us. Because if we don't do something on Friday, if a restaurant wanted to open or if a hair salon wanted to open, they could do that until such time as you as council put in an alternative rule. Or I put in temporary language and then you guys can finalize it, I guess. I'm a little bit unclear.
Need to hear from everyone.
Holly?
Need to hear from all of
This
them.
is Councilman Schaefer.
Councilman Schaefer.
Yeah, I agree with Councilman Baylor that I think we should stay as is for, starting Friday through next Wednesday, at least when we have our next meeting, so we can talk about it. It'd be more disruptive, I think, to change the rules to go with the state and then put things back into place if that's what we had then decided to do on Wednesday. So I think that would provide the least amount of confusion and greatest continuity is just continue as we are until we've, spoken with our medical team, spoken with the business community, and gotten some public input.
Okay. Does any...
Councilman Sherman?
Sherman.
So, but the way I understand it, we will be in conflict on Friday if Helen does not put this in place.
That's what we're saying.
And I believe that.
Go ahead.
I believe that the manager needs to put this in place so that we aren't in conflict, so that we can stay status quo, and then we discuss it with the public, with all our research on next Wednesday.
Okay, great. Yeah, that's what Councilman Baylor and Schaefer were suggesting, and now you're in concurrence. Is there any other 4 councilmen who are not in concurrence with that?
I'm in concurrence, but coming through a little bit, the same reasons, but a little bit more. We've got this emergency management system set up to act efficiently and early, and if we start cutting them off the knees saying, no, we're not gonna let you do what you say you need to do with either the mask ordinance or the coming out of compliance with the new state mandates, would be counterproductive in the long term. We can take our time to discuss things after the fact and change things if we want to, but if we start taking away their power out of the chute to say, no, you can't do that stuff, we don't agree with you, you need to let us talk it to death before we do anything, would not be the best way to go about that.
We're doing it this way.
Okay, Councilman Allison? I'm just asking if you concur with just leaving the rules as are until the next special meeting.
Yeah, I mean, that's okay with me. I still disagree with them. I think we should go with the state, but I'm okay with leaving them like they are till next Wednesday.
Okay, Councilman Meyer?
Yeah, I also agree that we should keep things how they are operating right now, which would be not in compliance with the state coming up on Friday. So we need to keep things closed down, especially since we heard from the incident management team that the mutual agreements for local businesses haven't been all filled out. So we need to be able to get those from the local businesses and assess what they're doing and have a conversation with them about how they plan to open up to the public in a way that can still keep us safe. So we need to get those things in place, and I think that I and the rest of council is in agreement with incident management team to not open up to the economy come Friday and keep operating how we are in this kind of isolation, social distancing, only essential critical businesses open at this time.
Okay. Councilman Gleason?
Yeah, you got concurrence for me.
Okay. We're on the COVID-19 policy discussion, and what I've takeaways so far on the policy part are include on future agendas. This is a discussion item, this COVID-19 policy discussion item, and for next week's agenda, we'll have the 2 subpoints, the governor's repealed and the mask ordinance. Is there any further policy discussion?
Yeah, Mr. Mayor, this is Allison.
Councilman Allison.
Yeah, back to the enforcement, just a comment again, and I've stressed it in the past, but But I think the key to the enforcement is having the visual presence out there of somebody checking, you know, and whether that's 2, 4, 6, 8, however many you want to have, but as long as there's people out there checking and people see that there's people checking, that's going to be the key. You know, I'm not going to look at, you know, the number of tickets written. I hope that there's no tickets written, but there needs to be a presence in the public showing that we're doing enforcement.
Okay, thank you. Further policy discussion, Council?
Just a quick one.
Councilman Baylor.
Yeah, it's because the business plans issue was brought up, and I've had calls to people asking me questions. I refer them to the city site, but you know, I don't allow 5 people in my store and that. So if we have some businesses that haven't turned in their plans, we have all our business lists. It wouldn't be that big of an effort, I don't think, if we could find somebody on staff to call up the businesses and say, hey, your plan's not in. Is there questions? Do you understand? I mean, again, the whole idea is to get everybody to comply and reach out. So, and quite frankly, I'm not even sure I have to have a business plan. I have a business. So that might be a thought, is a way to reach out to people and say, hey, you haven't filed one. What, you got any questions? What can we do to help? So just a thought.
And to respond to that, just to reassure everyone, in the incident command team, there's subgroups, and there is definitely a group that's working with industry, and they meet every week through telephones. So local businesses, the fishing industry group is meeting. We've had some task forces, and so all of them know, and they're being followed up on with incident command. So there's a lot of those mutual aid agreements that are in. We don't have everyone yet, but we're definitely collecting them regularly, and everyone is complying. So I don't think this is a big issue, but we do have some follow-up to do with specific businesses that we haven't heard from. But many of them just haven't gotten into town.
Okay, other policy discussion, Council? Okay, pending agenda and calendar. And what I have is a special meeting for next week that includes this additional item on the agenda for policy discussions, and specifically to next week, the governor's repealed mandates and the mask. Anything else,
How
Council?
about the work session with NBE? Are we doing that every week, or will?
I believe so.
Okay. But when? What's today?
I think noon Wednesday is what settled on it.
Well, it had been 3 p.m. Thursday, and then it changed to noon Wednesday.
I think we can reach out.
Okay,
And
sounds good.
we'll just reach out to NBE.
Okay.
Okay, hearing no pending agenda items, we're back
Oh,
to
sorry, Selena.
Councilman Meyer.
I would like to have some kind of update or discussion about finances. It's not something that you have to run out and do right today, because I understand the budget's kind of out the window a little bit, but that is one of council's, I think, oversight that we need to get updates about is finances. I know that we got an email about CARES money coming in, and we have a new finance director. So whenever is most convenient to be able to get some documents together, or even just a verbal report to council, I would like some kind of update on finance, where we're at, how much we spent, kind of thing.
May 6th regular meeting item?
Yeah, that was fine.
Okay, so the request, Helen, was for a finance, okay, I wasn't sure if you caught that. Okay, thank you, Councilman Meyer. Other pending agenda items?
Yeah, Clay, what exactly is going on Wednesday's agenda that I would love an update on our enforcement, how far we've gotten with what we're asking for today.
Okay.
Is that already on there?
So we have the incident management team report, so those items would be presented, those would be updated on, yeah. Okay, other pending agenda items, council? Okay, we'll go back to audience comments on the audience, on the call-in line. And that number again is 253-6202. And you'll be asked to state your name for the record. And when you're taken off hold, mute YouTube. And you'll have 3 minutes for discussion. And I think for expediency, while we're waiting for any of the audience to call in, we can move to council comments. And I'll start with Councilman Gleason.
Just make sure everybody in the community is following the protocol, and I appreciate the letters and stuff that we're getting. You know, a lot of good reminders in there, and that's it. And and I better thank staff. I know there's frustrations that come out during the meeting, and I hope that everybody understands that this is a stressful time. So I'll just take a quote from Tony. I don't bring my feelings to the meeting. So if I'm doing something that Paul reprimands me for, that's all right. I can take that, and that's it. So that's all I got.
Okay, thank you. Councilman Schaefer.
Yeah, thank you to staff and everyone in the community who's volunteering. And also thank you to everyone submitting letters and phone calls. It's good that so many people are engaged and taking it seriously. And yeah, I feel like we had some really good discussions today, so thanks everyone.
Okay, Councilman Baylor.
Oh, I see the new website is up and running, and I appreciate that, all that worked on it. I did get a chance to click on some of the frequently asked questions. I'm assuming there'll be more. You know, as far as the mask issue, I think there'll be some on that. You know, if you work in an office, you don't allow public in, and you keep 6 foot away from their coworker, do you have to wear the mask inside? There's going to be a lot of discussion and clarification. But thanks for all your hard work. Don't anybody take it personal. We're just trying, everybody, the community, everybody's trying to do what's best for the community, and I will always err on the side of getting more public input on anything we can. Thank you.
Councilman Sherman.
Thank you, Mr. Mayor. I just wanted to really congratulate the CCMC team, Greg Meyer, for all that work he's been doing for funding and the loan and the grants. It shows pretty amazing efforts. And also wanted to compliment staff and Helen on the harbor submission. I know how long that has been in the works. I know how many times we tried, and try again is definitely a good motto, and I think that is a project that will really get some attention this time around. And I just wanted to compliment the IMT team for all that they are doing. I know they're going as fast as they can and double checking signs, but as soon as those signs get up, I know that's going to be a big help. And I'm excited about all the conversation we had today. I think the community service officers are going to be a really great addition to what we need and what I'm hearing from the public. Thanks everybody for your time today too.
Thank you. Councilman Gard.
Yeah, I'd just like to thank staff, command team, and everybody for everything they're doing. It's nice that we're finally having some of these discussions and being able to see some of the work they've had going on for a long time. It makes a lot of us feel better that we now have find or now have proof that all this stuff's going on, that things have been getting done. I'd like to thank community members all the way down to the folks wearing a mask and washing their hands several times a day to help take care of themselves and their neighbors and friends and family. This is the only way we're going to beat this if we all do it together. So thank you very much.
Thank you. Councilman Allison.
Nothing I can say that hasn't been said already. Thank you.
Thank you. Councilman Meyer.
Yeah, same. Website looks great, and I know that you guys are still working on doing some fillable forms on there, so that'll be nice to see too. Everything's kind of a work in progress, so just want to encourage the public to still submit their questions to the Cordova Prepared, anything that we can do and the incident management can do to make this easier and get the right information out. And just one thing about the face coverings, just everyone remember to wash them at home. I wash mine as soon as I get home, just in the sink with some hot water and some soap, and then hang it to dry. And I have my other one that's already dried, clean, so that if I need to go outside while that was drying, it's really easy to do. I know that face coverings are hard to get a hold of. People are working hard to get them sewed up. There's a couple options to purchase, and I know I was using a handkerchief and a scarf while I was waiting for mine to come in. So there's some options out there. Google them, keep them clean, and stay safe, everyone.
Okay, thank you, Councilman Meyer. So we didn't have any audience comments call in, but your incident commander wanted to have some wrap-up audience comments.
Yeah, just one last thing. I'd like to let everybody know that, the city of Cordova is known throughout the state of Alaska for our emergency response. And our incident management team and our city of Cordova council community, we are actually years ahead of most communities where we stand right now. Our medical staff started this back in January and February, started working together. So our plans are working. Most communities don't have a harbor plan. Most communities don't have an airport plan. Most communities don't have an incident management team. So if we're just waiting on a sign to go up in the harbor, I feel pretty good about where we're at right now. So thank you.
Thank you. So we just have one more item. Entertain a motion to adjourn.
Move to adjourn.
Second.
Have a motion and a second. Is there any objection? Hearing none, we're adjourned.